Jusqu'en 2011, les patients de Terre-Neuve-et-Labrador avaient de la difficulté à obtenir des consultations en chirurgie orthopédique en raison du système d'aiguillage qui engendrait de longues périodes d'attente.
We had, fairly significant wait times and really weren't meeting the demand in terms of the patients that needed to be seen by surgeons. So that really ultimately is what central intake has tried to achieve.
We had a very ambiguous referral process before, much like had evolved over time for a lot of different places where a family doc just wrote on a prescription pad, please see regarding knee, or on the bottom of an x-ray report, please see, no details, nothing at all.
We had no measure even of wait time one, so our biggest challenge was developing a database or an information system to collect all this data.
We don't really have a good idea how many people are on the wait list, and within that, we knew there was thousands, but didn't really know how many of them had a hip problem, how many of them had a foot problem, how many of them had a shoulder problem.
Another major issue we had in the whole implementation of this model was the backlog of patients. There was over 5,000 patients who were booked. Depending on which surgeon's wait list they were on, it may have been for up to 18 months.
And certainly one place we saw that we could improve things here was having a central intake, and that would help our most needy patients get seen sooner.
With the central intake system, it is an improvement. It's twofold, really. It identifies the number of patients that we have waiting to be seen, and also the acuity of the patient. Once the referral comes in, it's assessed, and based on priority, then the patient is seen.
People who can best benefit from actually seeing us, as opposed to some other non-surgical treatment, we see them sooner. And so you could see in your clinics, you're seeing more stuff that you really needed to see because you had something that you could offer them, versus maybe you just need to try some pills, maybe you need to lose some weight, maybe a whole bunch of non-surgical things that really it doesn't take our level of training to be able to direct somebody along those lines.
The other thing that happened is we got really good data on how many people were waiting. And not only that, we know exactly how many need a knee replacement or are being seen about their knee, how many are being seen about their hip, but also how many are seen about their foot, their shoulder, their neck, whatever. So then we could direct resources a little bit better to try and deal with the many-headed monster.
We addressed the full continuum of care. So we didn't just improve wait time one and get patients to their surgical wait list quicker. We also worked on the surgical wait list to decrease that. We really had a great team who really interacted with family physicians and surgeons and other care providers within the system.
Le projet Orthopedic Central Intake a permis d'améliorer l'ensemble du continuum de soins. Les patients reçoivent des services préopératoires et post-opératoires afin d'être mieux préparés pour leur intervention. La Total Joint Assessment Clinic a été créée avec le but d'améliorer l'efficacité des services hospitaliers.
We approached the surgeons' offices and said, if you could give us the list of patients that you have that you know are going to have surgery in the next few months, we'd like to see them earlier. So long before they come in the hospital, a couple of months ahead of time, we'd like to bring them into the clinic. They would see the nurse, the physiotherapist, the social worker, the occupational therapist, and we'll spend some time with them and their primary caregiver and explain to them what's going to happen when they come in the hospital.
And the Total Joint Assessment Clinic, I think, has helped the OR be more efficient by identifying issues with patients before they actually get to the OR.
They know what to expect when they go into the pre-admission clinic, and they know what to expect afterwards. They're more familiar with the equipment and where they can get it, so they just feel overall less anxious about the surgery.
Most patients don't really know how much we've changed until they get into the system, because they still expect that they're going to be a year or two before they get done. And many of them, when they actually come, are like, wow, this was only 3 months or 4 months or 6 months. I really thought it was going to be much longer.
Le projet Orthopedic Central Intake a aidé l'autorité régionale de la santé à mieux évaluer les pratiques en matière d'aiguillage et à mesurer les services de renvoi en consultation.
Without, engagement from all levels, this wouldn't have been a success at all. And I would be talking probably more about what you shouldn't do when you're trying to develop a program as opposed to what works.
The orthopedic surgeons actually probably got about a 30 to 35% increase in their operating room time based on this whole model.
Well, it's nice that my wait list now is 5 or 6 months instead of a year and a half.
Right now, a patient will be referred to see a physician. If they're deemed to be urgent, they will be in to see their physician within 90 days, and a lot of them are on the surgical wait list and have their surgery completed within 6 months. I met someone recently outside of here who had that experience, and it's the way the system should work.
While nothing in life's guaranteed, most people are very, very happy, genuinely happy with the results they get. So whether it's a young person or an older person, giving them back their quality of life is, some things in the job have gotten stale. That hasn't gotten stale yet, and I hope it never does.